My name is Elisa Bruno. I'm a neurologist and a clinical research fellow at King's College London, and I'm part of Work Package 4, so the Epilepsy work package into the RADAR project. Epilepsy is one of the most common neurological disorders, and it affects more than 70 million people worldwide. So it's very difficult for a patient to keep track of all the information, all the seizures in a seizure diary, for example. And it's difficult for clinicians to judge, for example, if after starting a therapy, the patient has improved in terms of seizure frequency or not. And so wearable devices can provide a more accurate way to objectively identify seizure frequency before, for example, starting a treatment and after starting a treatment, and help us evaluating the benefit on a specific individual.
I work in RADAR-CNS work package 9, and our work focuses on looking at how the radar remote measurement technology system could be applied in practice in each of the clinical areas. In epilepsy, a person with epilepsy may wear a wearable device which could send an alert to their informal carer and to the patient themselves at the time of a seizure or just before a seizure. You reduce the risk of injury, so it could be really quite radically beneficial to have this kind of device.
Certainly they can help also at identifying different seizure types. So you can have seizures manifesting with very violent, evident movements such as tonic-clonic seizures, and other seizures that are not easily detectable or noticeable, for example, with just reduction of patient's awareness for a few seconds. So wearables can also help at differentiating seizure types and at having an idea about the impact of the seizures on patients' quality of life.
It would be great just for that information to be sent to your neurologist so they can see it ahead and just give them a better idea of with medication working or from emotions or stress, to have that information in front of them.
So I think that one of the most important findings of radar epilepsy has been reflected by a paper that was published and that also got an important award, and is related to the possibility of wearable devices to identify seizures at higher risk of SUDEP, which is sudden unexpected death in epilepsy. So we managed to develop an algorithm that was able to identify some SUDEP biomarkers, and in particular post-ictal immobility. So this is very important because using wearables we may identify post-ictal states that are at higher risk of lethality, and the devices can be applied into future research aiming at reducing the risk of SUDEP. This technology is very welcomed by the larger epilepsy community, so patients, caregivers, healthcare professionals. It's very needed. I think that really the applications of wearables into the field of epilepsy are limitless, almost limitless. And so certainly we have collected a lot of data during the RADAR study, and we need to analyze this data, and we need to identify which are the most important clinical questions that we want to answer, starting from this big data collected.